Imagine discovering a small, unusual mole on your skin. It might seem harmless at first, but could it be the beginning of something more sinister? Melanoma, the most dangerous form of skin cancer, often starts with subtle changes that are easy to overlook. With its incidence rising, particularly among those under 40, understanding this deadly disease has never been more crucial. Did you know that 30% of melanomas arise from existing moles, while the majority develop on seemingly normal skin? This stealthy nature makes melanoma a formidable opponent in the battle against cancer. But here's the real shocker. Despite accounting for only 1% of skin cancer cases, melanoma is responsible for the majority of skin cancer-related deaths, especially among young adults. Melanoma is a type of skin cancer that originates from melanocytes, the cells responsible for producing melanin, which gives skin its color. It is considered one of the most serious forms of skin cancer due to its potential to spread rapidly to other parts of the body if left untreated. There are several types of melanoma. Superficial spreading melanoma. This is the most common type, typically appearing on sun-exposed areas like the arms, legs, back, and face. Nodular melanoma, a more aggressive form that grows vertically into the skin rather than spreading across the surface. Lentigo maligna melanoma often develops in older individuals on areas with chronic sun exposure, such as the face. Acral lentiginous melanoma. Less common, this type occurs on the palms, soles of the feet, or under the nails. Ocular melanoma, a rare form that develops in the eye. Mucosal melanoma, another rare type that can occur in the mucous membranes of the body. Several factors can increase an individual's risk of developing melanoma. 1. UV radiation exposure. The primary cause of melanoma is exposure to ultraviolet, UV radiation from the sun or artificial sources like tanning beds. This includes history of severe sunburns, especially during childhood or adolescence, living in sunny climates or at high altitudes, frequent use of tanning beds. 2. Skin type, fair skin that burns easily, light-colored eyes, blue, green, or gray, blonde or red hair. 3. Moles, high mole count, more than 50, presence of atypical moles, dysplastic nevi. 4. Age. While melanoma can occur at any age, the risk increases with age, particularly in individuals over 40. 5. Gender. Before age 50, women are at higher risk. After 50, the risk is higher in men. 6. Family history. Having one or more close relatives with melanoma increases risk. 7. Personal history, previous melanoma diagnosis. History of other skin cancers, basal cell carcinoma or squamous cell carcinoma. 8. Weakened immune system. Conditions or medications that suppress the immune system can increase risk. 9. Genetic factors. Certain genetic mutations can predispose individuals to melanoma. 10. Chemical exposure. Exposure to certain chemicals, such as arsenic, may increase risk. It's important to note that having one or more risk factors doesn't necessarily mean an individual will develop melanoma. Conversely, people with no known risk factors can still develop the disease. Recognizing the signs and symptoms of melanoma is crucial for early detection. The ABCDE rule is a helpful guide for identifying potential melanomas. 1. Asymmetry. One half of the mole doesn't match the other half. 2. Border. The edges are irregular, ragged, notched, or blurred. 3. Color. The color is not uniform and may include shades of brown, black, or tan. Red, white, or blue may also appear. Diameter. The spot is larger than 6 millimeters across, about the size of a pencil eraser, although melanomas can sometimes be smaller. 5. Evolving. The mole is changing in size, shape, or color. Other signs and symptoms to watch for include a sore that doesn't heal, spread of pigment from the border of a spot into surrounding skin, redness or a new swelling beyond the border of the mole. Change in sensation, itchiness, tenderness, or pain. Change in the surface of a mole. Scaliness, oozing, bleeding, or the appearance of a bump or nodule. In advanced cases of melanoma, symptoms may include hard or swollen lymph nodes, difficulty breathing or coughing, unexplained weight loss, fatigue, headaches, or seizures. It's important to note that melanoma can also occur in areas that aren't typically exposed to the sun, such as between the toes, on the palms of hands or soles of feet, under the nails, in the mouth, nose, or genitals, in the eyes. For individuals with darker skin tones, melanoma is more likely to occur in these hidden areas, making regular full-body skin checks crucial. Skin examination is a crucial first step in diagnosing melanoma. Dermatologists and healthcare professionals employ various techniques to assess suspicious skin lesions. Visual inspection, carefully examining the skin for any unusual moles or growths. ABCDE criteria, evaluating moles based on asymmetry, border irregularity, color variation, diameter, and evolution. Dermoscopy, using a handheld device to magnify and illuminate skin lesions for more detailed observation. Advanced photographic techniques have enhanced the reliability of clinical assessments. These include total body photography, documenting the entire skin surface for future comparisons. Serial digital dermoscopy, taking sequential images of suspicious lesions over time. When a suspicious lesion is identified, a biopsy is typically performed to confirm the diagnosis. Common biopsy techniques include as shown in the table. If there's concern about metastasis, various imaging tests may be employed. CT scans, MRI, PET scans. These tests help detect potential spread to lymph nodes or other organs. Staging is crucial for determining the extent of melanoma and guiding treatment decisions. The staging process involves 1. Assessing tumor thickness. 2. Checking for lymph node involvement, often via sentinel node biopsies. 3. Evaluating for distant metastases. Factors influencing risk assessment include ulceration of the tumor, mitotic rate of cancer cells. Staging helps healthcare providers determine the most appropriate treatment plan, which may include surgery, radiation therapy, immunotherapy, targeted therapy, or chemotherapy, depending on the cancer's characteristics and stage. Now that we have covered the diagnosis and staging of melanoma, let's explore the various treatment options available. The approach to treating melanoma depends on factors such as the cancer stage, location, and the patient's overall health. A. Surgery. Surgery remains the primary treatment for melanoma, especially in early stages. It involves removing the melanoma and surrounding healthy skin, potential removal of affected lymph nodes. For thin melanomas, surgery alone may be sufficient. However, deeper melanomas often require additional treatments to ensure all cancer cells are eliminated. B. Immunotherapy. Immunotherapy enhances the body's immune response against cancer cells. This treatment boosts the immune system's ability to combat cancer. May be used in combination with other therapies for advanced melanoma. C. Targeted therapy. Targeted therapy focuses on specific attributes of cancer cells. It attacks unique characteristics of melanoma cells. Can be particularly effective for certain types of melanoma. D. Radiation therapy. Radiation therapy uses high-energy X-rays to eradicate cancer cells. It can reduce tumor size, alleviate symptoms in advanced cases. The treatment planning for radiation therapy involves determining the appropriate dosage, identifying the exact area to be treated, scheduling multiple sessions over a period of time. E. Chemotherapy. Chemotherapy employs potent medications to kill cancer cells. It is primarily used for advanced melanoma cases, when other treatments are unsuitable. With these treatment options in mind, next, We'll explore prevention strategies to reduce the risk of developing melanoma in the first place. Now that we have covered the diagnosis and staging of melanoma, it's crucial to focus on prevention strategies to reduce the risk of developing this serious form of skin cancer. A. Sun protection measures. Sun protection is paramount in preventing melanoma. Here are essential steps to safeguard your skin. Apply broad-spectrum sunscreen with SPF 30 or higher daily, even on cloudy days. Reapply sunscreen every 2 hours or after swimming or sweating. Seek shade, especially between 10 a.m. and 4 p.m. when UV rays are strongest. Wear protective clothing, including broad-brimmed hats and UV-blocking sunglasses. Be extra cautious in reflective environments like water, snow, and sand. B. Regular skin self-exams. Early detection is crucial for successful treatment. Incorporate these practices. Conduct monthly self-examinations of your skin. Use the ABCDES of melanoma as a guide during self-checks. Familiarize yourself with your skin's normal appearance to spot changes. C. Avoiding tanning beds. Tanning beds significantly increase the risk of melanoma, especially among young adults. It's crucial to abstain from using tanning beds entirely. Educate others about the dangers of artificial tanning. Opt for safer alternatives if a tanned appearance is desired. D. Knowing your skin type. Understanding your skin type can help you take appropriate precautions. Identify your skin's sensitivity to sunlight. Be aware that some medications may increase sun sensitivity. Adjust your sun protection measures based on your skin type. For melanoma survivors, sun safety is even more critical due to a 9-fold increased risk of recurrence. Regular follow-ups with dermatologists and adopting sun-safe habits are essential for long-term health. Melanoma is a serious form of skin cancer that requires vigilance and proactive measures. Early detection through regular skin checks and awareness of the ABCDE rule can significantly improve outcomes. Understanding the various types of melanoma, their characteristics, and risk factors empowers individuals to take control of their skin health. Prevention remains key in the fight against melanoma. Minimizing UV exposure, wearing protective clothing, and using high SPF sunscreen are crucial steps. For those diagnosed with melanoma, a range of treatment options exists, from surgery to targeted therapies and immunotherapy. Remember, staying informed, seeking professional medical advice, and maintaining a healthy lifestyle are essential in managing and reducing the risk of melanoma. By prioritizing skin health and embracing preventive strategies, we can work towards reducing the impact of this potentially deadly cancer.